Welcome to this teaching video on siesta, sleep for inpatients, empowering staff to act, supported by generous funding from the American Sleep Medicine Foundation and the National Institutes of Health. During this video, we will be reviewing the importance of sleep and the scope of sleep problems among inpatients, and we will be discussing specific factors contributing to poor quality sleep in the hospital. By the end of the video, you should be able to state 3 reasons that sleep in the hospital is important for patients, and state 3 things that you can do to improve the sleep of your inpatients. Let's start by reviewing the importance of sleep and the scope of sleep problems among inpatients. Sleep has many important biological functions. Research has shown that energy use by the body is reduced during sleep. For example, both caloric utilization and body temperature decrease during sleep as compared to wakefulness. As you can imagine, energy conservation may be of increased benefit among hospitalized patients with acute illnesses. Sleep also provides an opportunity for the body to restore and repair itself. Many of the major restorative functions of the body, such as muscle growth, tissue repair, protein synthesis, and growth hormone release, occur mostly or in some cases exclusively during sleep. Among hospitalized patients, sleep loss can have a variety of adverse effects. For example, sleep deprivation can be associated with high blood pressure, an increased risk of hyperglycemia, and an increased risk of delirium. These can lead to clinical responses in the form of polypharmacy, such as extra medications for blood pressure control, blood sugar control, sedative hypnotics for sleep, and antipsychotics or restraints for delirium. Unfortunately, these clinical responses can have extra deleterious effects. Patients are often exposed to an increased risk for hypotension, hypoglycemia, delirium, and falls. Sleep loss among hospitalized patients can also lead to significant patient symptoms of fatigue and daytime sleepiness. These are important because they can not only hinder participation in recovery, such as in therapy services or discharge care planning, but can also make it more difficult for clinicians to assess for recovery from acute illness. The effect of these outcomes could include patient functional decline, increased hospital length of stay, increased risk of repeated emergency room visits or readmission, and a higher rate of noncompliance with discharge care planning. All of these effects become more pronounced as patients become older and have additional illness. So how significant is sleep loss in the hospital? Data from research done at the University of Chicago suggest that patients average 40% less sleep in the hospital than they do at home. In fact, the average patient in this study slept only 4.5 hours per night while in the hospital. Imagine how you would feel with several nights of only 4.5 hours of sleep, especially in the midst of an acute illness. Not only do patients get significantly less sleep while in the hospital, but they also note greater difficulty falling asleep and staying asleep. Studies suggest that more than 1 out of 3 patients have significant problems with insomnia while in the hospital, and this could be due to multiple factors, as we'll be discussing next. Now that we've reviewed the importance of sleep and the scope of sleep problems in the hospital, let's discuss specific factors that contribute to poor quality sleep among inpatients. These include environmental factors, factors related to medical care, underlying patient factors, and underlying sleep disorders. Starting with environmental factors, hospital noise is more than just an annoyance. Did you know that the Centers for Medicare and Medicaid Services has recently made patient-reported noise a publicly available quality measure? Unfortunately, studies show that hospital noise continues to be the single biggest factor contributing to poor quality sleep among inpatients. Although the U.S. Environmental Protection Agency recommends a maximum noise level of 45 decibels during the day and 35 decibels at night, research done at the University of Chicago using sound meters on hospital wards shows that these recommendations are frequently exceeded. In fact, this research has demonstrated that peak noise levels during the night frequently approach the level of a nearby vacuum cleaner, and daytime peak noise levels frequently approached the level of a nearby chainsaw. So we know that hospital wards are noisy, and we also know that with louder environments, patients are likely to get less sleep. In a recent University of Chicago study, sleep in the loudest environments predicted 76 minutes less sleep per night than those sleeping in the quietest environments. In that same study, 60% of patients with loud sleep environments reported that the most common source of excess noise was staff conversations in the hallway or near their door. This finding highlights the role that we all play in the quality of our patients' sleep. Beyond noise, multiple other factors have an important role in patients' sleep. These include medical care factors, such as nighttime vital sign checks, phlebotomy and finger sticks at night, nocturnal medication administration, nocturia as a result of evening diuretics, and patient care alarms going off at night. Patient factors that may be contributing include untreated pain or unaddressed anxiety. Finally, as alluded to earlier, underlying patient sleep disorders may have an important role. These include untreated insomnia and unrecognized sleep apnea. So to recap, during this video, we have discussed reasons why sleep in the hospital is important. These include energy conservation, restoration and repair of the body, improved blood pressure control, improved blood sugar control, better participation in care and therapy services, and a decreased chance of delirium. We discuss specific factors that contribute to poor quality sleep in the hospital, including environmental factors, the most important of which is noise. And we discussed medical care factors. Finally, we discussed patient factors, and we alluded to screening your patients for underlying sleep disorders. In terms of things you can do to help improve the sleep of your hospitalized patients, the mnemonic siesta can help you remember important action items. S. Screen for sleep disorders. Ask about insomnia. Screen for prevalent sleep disorders like sleep apnea. I. Instruct your patients on the importance of healthy sleep habits and empower them to advocate for their sleep while in the hospital. E. Eliminate unnecessary nighttime awakenings. See if you can batch vital sign checks and medication administration at night. Avoid dosing of medication that disrupts sleep needlessly. S. Shut doors and isolate staff conversations. Move conversations away from hallways. T. Treat symptoms. Address your patient's pain, anxiety, or other factors that may be interfering with their sleep. And finally, A. Alarm and noise control. Remove non-essential alarms, set alarm thresholds appropriately, and limit other sources of noise such as phones and pagers.